Therapy in County Durham. And we know a few of you just be logging in now. And thank you to all the people that messaged and emailed us with suggestions for the kind of things you'd like to see talked about with our Facebook Live presentations. So we're trying to do these once or twice a week, not too often, but just enough to talk about topics that are relevant to the corona lockdown isolation situation. So we've obviously covered a lot of things so far. We've covered the home program that we've recommended that people do on a daily basis. Obviously last Sunday we talked about the running injuries that we're seeing from the corona lockdown situation. And so one of the suggestions that came up this week was to talk about the workstation, working from home. How do we help some of the problems that people are encountering with working from home? So workstation related stuff, working from home itself, and how we work through this, because it's a very different work environment we're dealing with now. Obviously it's going to be closer to 2 months than 1 month really that most people in some shape or form have been working from home, and it may be the hours are the same, it may be the hours are increased, it may be the hours are decreased of working from home. Everyone's going to be different, but we are seeing a lot of work related injuries purely because people are working from home, and that has to be talked about straight away. So we're not doing today as an ergonomic must look like this. It's just to talk about what we're seeing, recommendations of what we think can help to prevent injuries being directly caused from working from home because of the coronavirus situation. And this is obviously worldwide. I talk to people around the world and people that have been working from home. It's consistent worldwide. Obviously the countries that are locked down for longer, people are being advised or being asked to work from home for longer, are more likely to get these injuries that we're going to talk about. And very much it's the backs and the necks and the arm type injuries relating to the fact that most people might be on the computer. So we think about the pictures from this morning that we put on the little post to tell you about this. Were you any of those pictures as to what your workstation currently looks like? The first picture, I think I had a lady with the laptop sitting against her settee like this, and the laptop was there, and the cup of coffee was there, and the pieces of paper were there, and that is her situation. And the picture looks pretty good, she looks pretty happy, and I just wonder, after 7 hours of that position, of a really busy day, how she's faring. So that was an interesting one. It was that low-level workplace station. I think the legs might have been crossed as well. So how long would she be able to hold that, on the assumption that she wouldn't have worked in her office before the corona lockdown in that position? So that was the first one. The second one was an interesting one. I think there was a chap at the kitchen table. I'll just use this as the equivalent of the chair. He had the kitchen table, which is about this high. He had the quirkiness of one of his children, the young toddler, on his shoulders, having a little bit of time, and he was having a bit of fun working, and he had the child on the shoulders. So again, looked happy, child was happy. Again, after 7 hours of that, I'm not sure neither parent/worker or child would be as comfortable as what they were in that picture. So two extremes of positions. The third one I put on, and I'll just angle it round this way so you can see a ledge, was someone that had been very ingenious and had a standing up setup using an ironing table. So this is a little bit higher than the ironing table. It might have been about that height, maybe chest height. And the person was clearly using the laptop on the ironing table. I think they even had another bench behind it with a monitor and the keyboard on one level and the monitor on the other. So that was more of a standing version. So we had 3 examples of what could a home workstation look like: on the ground, on a kitchen table, or in a standing position with an ironing board there. There's no right or wrong for each person. That obviously works, for that particular photo to be found. But really everyone's going to be different, and they're going to be doing different durations. That's really important. The most important thing is to treat it like your office. What would your office look like in a perfect situation, and how close can you make your home workstation to the office, assuming that the way your office was set up was good? Presumably, if it wasn't, you would have done something about it with occupational health if you're in a bigger company, or whatever you could have done if you had a smaller setup there. And I think if you can get as close as to what you see as the best view, then you're well and truly on the way. Whereas I think the home working has caught a lot of people by surprise. The demands of work are the same. the laptop and the computer is obviously in play, as are the smartphones and the tablets, and then perhaps all of that gets done first, and then the workstation is thought about at a later date, and that may be when someone is injured. So by far the backs and the necks are the injuries we are seeing in quite big numbers that we're having to treat remotely, to identify, to look at what the actual diagnosis is, treating them as we do, but also saying, right, before we finish this video call, I need to see your workplace. And there it is in black and white, the answer, which has probably been, on the person's mind. The patient's worked it out, but actually until you change the cause, are you really going to prevent that pain from coming back? So it doesn't matter how many of the strength exercises you do, or how much of the foam rolling of a new lower back injury you do, if you're not going to change that workplace as the cause, you're still going to run into potential problems. So that's important. Treat it like your office. So in terms of, not spending too much time on this one, but what would the perfect position look like? Well, I think we look in, on the internet, you'll find plenty of information, and a lot of people in occupational health know from a position point of view, and I'm just going to hide the ball there. That would be the kind of starting position. We would like to see 90 degrees at the hips, and we would like to see 90 degrees at the knees. This is a little bit low for me. Obviously, I'm a Swiss ball fan, I use it all the time, and therefore I achieve the same. 90 degrees at the hips, 90 degrees at the knees. Both of those positions here and here right now, I have a back that is straight, and I'm not letting myself be in a curved back, which would be very inefficient for the course of the day. If I just turn this a little bit and we bring the arms into play, well, what would we like? We would like the forearms, the wrists, the hands to be in a nice straight line and parallel to the floor. That would make sense. At work, we have tables and desks that allow us to do that in a sitting job. So if I take these three cushions away and I make this my desk as it were, you can see I'm nowhere near. I might turn around and make it even easier for you to see angle-wise. If this was my desk, I've got my 90 degrees, but I'm not parallel to the ground. Arms fall, and then I might do a bit of that to type, and you can see I'm nowhere near where I need to be. Whereas if I then brought in something like cushions or whatever it is you've got at home, if it was possible to put my laptop on there, then at least you can see my forearms, wrists, fingers are all in a straight line. Therefore, if that was my laptop, I'm in a much more ergonomically sensible position. That would reduce the risk of a whole lot of injuries. So already you can see the height of the desks people are using has to be considered, and I've just used three simple cushions there to make it much better. In terms of the chair itself, I've always had a line I've used on patients that the best ergonomic chair won't help the weakest person, and people for decades have spent lots of money, companies have, on very expensive ergonomic chairs. But if the person doesn't know how to use their muscles to support their body, particularly their back and their neck, you don't tend to get a good long-term outcome. They might be very comfortable in the chair at the time, but when they get out, actually people can be worse for sitting in what, these more exclusive or expensive chairs. So in terms of the best chair, there is no such thing in my world. I think you've got to use the chair that suits your body for your strength. And my best chair will always be a Swiss ball, because I know that without the lack of the backrest as such, my core muscles have to take on that role. Therefore, if I was working at a desk all day, I know my stomach muscles will always be working to stop me from falling off the ball. We often encourage people to use a Swiss ball at home or at work, practice lifting one leg up. So if I was typing away for 5-10 minutes and I try and just march on the spot just slowly, I can still achieve the same job, and that low level core work, the core muscles work harder because I've simply got one leg off the ground. All of these things can be done on a normal chair. If you're in a normal chair and you're typing away at home, just lift up one leg. Low level core exercise, you'll feel your stomach work straight away, which mine does, and that will take away the potential back stiffness. The back muscle can't tighten up if the core muscles are holding the spine secure. So that's a simple strategy to think about. How can you change that lack of the perfect chair? Because actually maybe you don't need to change the chair you're sitting, it's just how you're sitting in it, how you're holding your posture. We don't tend to use the posture word these days, but that's exactly what you're trying to achieve, is a really good position. So that's one thing to think about there. Currently it's difficult because there might be other needs in the house. Other people might need the chair that you want to use, they might need the table, they might need the island. So you just don't know. Look at what else you've got around to help, so you're not forced into a position that's not ideal, such as the sitting on the ground that I showed at the start with the legs crossed. After 10 minutes, that person will probably be uncomfortable. So be very, very careful. The standing position is one worth looking at. A lot of people aren't thinking about that. People that have used standing tables successfully in the work atmosphere, we support that, and we think it's a very good thing because, again, you can get a good bit of core control when you're typing away the standing table. So maybe you need two places in your house, a sitting position and maybe a standing position, and we'll talk about the change of position next, but you've identified that both of those two are your most comfortable. Again, the arm position on the standing table or the standing, whatever you're going to use, could be useful. So if you've got something, say chest height, I'll go a little bit higher. Again, the wrist position in line, forearms, wrist, hands. I can do my work productively. May not be able to do that for long periods, but again, it's another option there. So in terms of the changing position, that now becomes even more important in the home environment, very much so. Now, a lot of us are changing positions anyway, particularly if we're trying to work and do homeschooling with the family and have a bit of an exercise. So we're probably changing positions, but are we changing position as much as what we would have in the office? There's no answer. Some people it's more, some people it's less. Some people have to walk in the office to go to the photocopier or their colleagues or meetings, and maybe now at home they don't have to do that. So could they be sitting for longer periods, which is obviously a negative. Other people may be actually doing more around the house to break up their work day. So you just don't know, but change of position is vital. How often? Why not make it 15 to 20 minutes? And if we make it simple, that it doesn't disrupt your work day, you might change position from that sitting on the ball or sitting on the good chair at home, and then you might go to a standing position. That in itself is a change of position, but why not take it a step further? Every time you go to that change of position, why don't you walk up and down the stairs 2 or 3 times? That 30 seconds of exercise will bring in all of your good muscles, including your core for your back, including your leg muscles to stop the hip stiffness, and it keeps you moving, and then you can go to where you're going to be in that next position for the next stint. Other people can take it a step further and do actual dedicated exercises, which again take no time at all. It could be that every 15 or 20 minutes you find that wall, I'll just move the cushions, and you do one of our favorite core exercises, just a simple standing mountain climber. Just do that for 20 to 30 seconds. You might add the press ups in the same position, and then the evidence we would show and be able to prove is that you've used your core muscles to do those exercises. Now you've got a green light to go back to your workstation. So if you're doing that every 15 to 20 minutes or half an hour, if that's a little bit too much to ask, those little 30 seconds add up over the course of the day. And at the end of an 8-hour working day at home, how tight are your back muscles likely to be versus your core muscles? The evidence would be that those people that keep on moving regularly, their back muscles would be far less tight and they would feel stronger for doing their core exercises. And again, lots of research to back that up. So that's really important. What is your home program going to be during the workday? We talk about routine and timetabling. It's tricky because it is different at work. Maybe you did have a dedicated lunch time and maybe you used it, maybe you didn't, maybe you went for a walk, maybe you had a coffee, maybe you didn't. But why not have that in the workplace to help prevent back and neck pain and other injuries? So let's have that dedicated lunch period. Computer's off, you're off to do the food, the lunch, you might do a bit of exercise as part of the daily program or up and down the stairs. What are the benefits? Well, we know that energy levels and concentration levels are going to be positively influenced, so you're actually going to work better for taking that break. Your productivity will therefore be better. I think most people would accept that, but then physically your body will be better. And again, that's hard. It's easy to get dragged into that long stint working from home because you're at home. There's no travel, you're there, you may as well do a few more tasks and away you go. But get that scheduled break in. I often find in my work environment here, I'm matching it to the homeschooling, and that's working really well for me. I know that I'm going to prepare the children's lunch or to do some more work with them. That's my lunch. It works, keeps me active. I'm very fortunate, I'm in an active job, so I'm always moving anyway, even in the home, but it's just another thing to make it easier for me to avoid injury. So that's important. Listening to the body during work and after work. If you're feeling a bit tight, then you're probably a lot more tight than just a bit tight because you're probably concentrating on work. So people are starting to feel a bit tight now, 3, 4, 5, 6 weeks in. You might be a little bit further along than what you think, but you just want to get that work done. But these strategies we're talking about means you pick it up earlier. You just keep on moving, get the good muscles working earlier, and therefore listening to your body is important. After work, you might have walked to the station or walked to the car. You may not have that option now. So really after working from home in a chair, is going to sit down in a chair going to achieve much from a physical point of view? We would obviously suggest it doesn't, and that's important. So if you're feeling tight, what are you going to do about it at the end of the workday? Between when you finish work and between whatever comes next, whether that be exercise or time with the family, there might be something small just as you finish work that could be so useful, and that could be stretching, it could be particular exercises. We would certainly advocate the use of the foam roller for lower back and neck. That's helping a lot of people who, when they've decided that work's done for the day, just from a position here you can see slightly side on, they just have their foam roller, they're on the roller, their hands are on the ground, they may not be particularly experienced, and they're just loosening off the lower back. You can turn the legs side to side to make it a rotation, and exactly the same for the neck. I can get onto the roller for the upper back there, and that mid back rolling up and down there, a little bit higher in the neck for the neck patients, can rotate their head side to side, and it's very much the equivalent of having the hands-on physiotherapy to loosen off tight muscles, but you're in charge. You're doing it at the right time because you're likely to be at your tightest after prolonged periods of activity in the workplace sense. So that prolonged periods of workplace sitting, those muscles are likely to be tight. So again, foam roller stretching, we would advocate the use of that as preventative ways to stop these kind of problems from happening, and doing it as soon as possible after work should then make the evening easier, which then makes the next morning easier. That's really important. The strength exercise, which is more to do with what we showed you on the wall before, they are vital to stop you from becoming weaker and weaker in this particular lockdown period. It's kind of got two parts of it. How do you keep your muscles loose, the bad ones? How do you keep the good muscles strong, which is more the core and the deeper neck muscles? And it just depends on what you do to do them, depending on what activities you're up to. So in terms of the injuries so far, I think it's been a classic lower back and neck. It's no different to what we see in the office environment, just more of them due to inefficient workplace setup. That's probably the things we're seeing the most. And I said nearly every patient has been an obvious problem. The height of the chair, the wrong chair, the height of the desk, not moving enough during the day, and not addressing it with particular exercises towards the back end of the day. That's probably the common theme we've seen so far. Now, just if there's any comments there, I'm just going to scroll down. We've got plenty of time at this end, obviously. Let's just see if there's anything that you'd like to ask, and be specific as you want. There's no problem asking about workplace related things. I might touch on the arm and shoulder one that was in the comments as we built up to this post the other day. The mouse position is tricky because it's obviously the position of the chair in relation to the table, but then changes the way that the person's using their arm, because it can be the same laptop, so it feels unfair that you haven't changed the computer, but where that computer is the problem. So I think anyone that's using a laptop that they're used to using at work, or if they travel with work, I would try and make that workstation mimic what's worked for you pre-corona, on the assumption you didn't have any arm pain, because you don't need to develop a tennis elbow or a wrist tendonitis, or the worst case scenarios would be more nervy problems from trying to be on that laptop in a different angle. So if you just think about that shape that we talked about, particular laptop users with the touchpads, you really need to try and find that horizontal parallel shape. The minute things are like this, or worst case like that, is that you're going to be in a problem place for the arm and the shoulder injuries. So a lot of those are often neck related, but they manifest themselves further down the upper body there. That's probably an important one there. Telephones is another one that did come up before someone puts that on the messages here. Are people spending more time on the mobile phones, less time on headsets? That's another factor for those people in those industries. Is there need for investment in a headset if it looks like the volume could be the same, particularly if you're then trying that awkward, I'll talk on the mobile phone and I'll do the typing, or of course the speaker on the mobile phone if the home environment allows. So, see if there's any questions or comments there. We will certainly be continuing this kind of themes with our Facebook live thread, so please suggest anything. We're happy to talk about anything relevant there. For those people that want more information about some of the preventative strategies, like the foam roller and the Swiss ball in the workplace, we do advise giving them a try. If you're having any problems with the back and the neck, we can organise Swiss balls to be delivered or picked up. That's no problem. Many people have done that so far. And then people that are doing the classes might be a bit confused about what we're saying here versus your strength program. Anyone that's doing a class like the Swiss ball that has the homework from those classes, do your homework as the priority, because that strength work's a little bit more targeted still. So we would say during the workplace day, if you're doing Swiss ball homework, that's a good time to do a couple of those Swiss ball exercises. You don't need to lower the level of the exercise to a more basic level if you've got the ability to do some of the Swiss ball exercises you're already doing in the class. And if you're doing that strength work during the day, then it means there's less of a need to try and back end it at the later period of the day, because you've already done your homework over the course of the day. So a lot of Swiss ballers are feeding back to us that they feel stronger, and that's probably because they're doing the homework regularly during the day to break up their day, and therefore they might be doing the homework more than what they used to when they used to be in the office pre-corona. So you can take that approach little and often, whether it's the Platinum Home Isolation Program that you'll be able to see on the Facebook that we obviously presented to the region, or it's a Swiss ball, same approach, little and often will always do better than trying to do everything in one part of the day, and the workplace will be the beneficiary of that. So any more questions, obviously contact us via the Facebook page or an email, and we look forward to speaking to you again soon. Bye then.